Hello, my name is Evelyn Keppinger. I'm the clinical nurse navigator in the NICU at Wolfson Children's Hospital, which is part of our Baptist health system here in Jacksonville, Florida. And I'm going to spend a few minutes today talking to you about cue-based feedings. Now, in the NICU, most feeding protocols are divided into two categories: your healthcare provider-driven protocol and your infant or cue-based feeding protocol. Healthcare provider is going to be your practitioner deciding when to start oral feeds on that infant, and often how many times a day, whether it's once a day, twice a day, 3 times a day to attempt oral feedings. The second one, that infant-driven, is basically what it says. You're listening to the cues from that infant. And you can have infants as early as 32 and 33 weeks showing signs that they would like to start oral feeds. You may also have 2 33-weekers who are at different ends of the spectrum, where one may be ready and starting to show some signs. The second one may need a few days or maybe even another week, and that's okay. Do not start the oral feeds until you know that baby is physiologically and developmentally ready. Some of the cues we look for are they rooting? Are they using a pacifier? Are they awakening before their feedings? Are they awake sometimes even during their feedings, especially if mom is holding them? Do they tend to stay awake and alert? We assess their muscle tone. Do they look relaxed? Some of the signs that show us that they're not ready yet are if they're trying to push the bottle out of their mouth, they're gagging, they're having increased work of breathing, maybe an increase in apneic episodes. So those are some of the signs that we look for. It's also important to realize that at this age, they may tire very easily. So if they tend to wake up a little bit early, sometimes you may want to go ahead and feed them a few minutes early, or try to settle them down with a pacifier so that they don't use up all of their energy fussing before the feeding, but they can use that energy to have a positive feeding experience. The quality of the feeding is something we assess with each feeding. How did that baby eat? Did he stay awake or was he falling asleep? How was his or her suck-swallow coordination? What was his work of breathing, volume? We want this to be a very positive experience. So we tend to, kind of decrease the lights a little bit, decrease some of the noise if at all possible, use a slow flow nipple, do careful positioning with these infants, and then we do involve the parents as much as possible and as early as possible in the process. So we do a lot of education with the parents on positioning. We do a lot of education on having them recognize the signs of work of breathing and how to pace their infant. Our goal is to have this feeding be a safe feeding, be a functional feeding, and to be a very positive experience for the infant and for the parent. So thank you very much for watching this Clinical Pearls video.